Biden speaking right now in Miami moments ago, speaking about President Trump as President Trump prepares to leave Walter Reed Medical Center this evening. Take a listen.
My prayers continue to be with the President and the First Lady for their health and safety, as they, like so many American families, are dealing with COVID-19. I was glad to see the President speaking and recording videos over the weekend. Now that he's busy tweeting campaign messages, I would ask him to do this. Listen to the scientists. Support masks. Support a mask mandates nationwide. Require a mask in every federal building and facility and interstate travel. Urge every governor and mayor to do the same. We know it saves lives.
This message from former Vice President Biden as President Trump prepares to go back to the White House this evening at his own insistence, even though doctors say he is not entirely out of the woods yet. And since the president first tested positive on late Thursday evening, at least 13 others in his orbit have tested positive, and what is playing out in real time as a prime example of how fast and how far this virus can spread when proper distancing measures and masks are not taken. Joining me now is head of the Infectious Diseases Division at the University of Nebraska Medical Center, Dr. Mark Rupp. Dr. Rupp, good to see you again. Let's walk through this timeline. The president was diagnosed Thursday. He had a fever and was given supplemental oxygen on Friday and took remdesivir and Regeneron. He was then taken to Walter Reed Medical Center, given an intense steroid and more oxygen on Saturday, and now he's going home? Does that make any sense to you?
Just a little bit accelerated. Clearly, the White House has extensive capability to care for the president on the confines of the White House, and I'm sure that that is partially driving the decision. But as you've pointed out, the president has received 3 different medications for this disease, including some of those that are generally reserved for more severely ill individuals. We also know that when somebody contracts COVID-19, that the first 5 to 7 days tends to be fairly critical, and that sometimes people can take abrupt turns for the worse, even after 5 or 7 days of illness. That's typically where we sometimes start to see deterioration. So I think the president's going to have to be, and will be obviously, very carefully monitored, and if he needs to get back to the hospital, I'm sure that his medical staff will do that.
Presumably he's still infectious. Fauci said earlier today to CNN's John Berman that he thinks that, from the moment somebody first gets symptoms, which as far as we know was last Thursday, you have to extend at least 10 days, which would make it this coming Sunday. Trump campaign communications director Tim Murtaugh just told CNN that the president intends to participate in the next debate, which is on October 15th, 10 days from today. Is that going to be safe for other people in the debate hall?
Well, generally, there's 2 strategies in removing somebody from protective isolation. One is, as you've mentioned, a time limiter in which people need to be at least 10 days from the onset of symptoms. The other modality is to do testing. And if the president was tested with the sensitive PCR assays and had at least 2 of those that were negative, it would be safe to bring him out of isolation. However, it should be emphasized that even under those conditions, it would be prudent for the president to be wearing a mask, to be limiting contact as much as possible, make sure that he has a very good physical distancing from others. People can intermittently be positive with these tests as well, and so that's something that would need to be guarded against.
I want to get your opinion about how safe it is for President Trump to debate on October 15th. Not safe for President Trump, safe for Joe Biden if he's in the same room with him. And we've just learned that Vice President Pence, who also was in contact with a number of people who tested positive, although we're told Pence has tested negative, Pence and Senator Kamala Harris, we're told, will be separated by plexiglass at Wednesday's debate. That's according to a source. If you were advising Senator Harris, or if you were advising Joe Biden, would you say plexiglass is enough? That's fine. Just be 10 feet away, 15 feet away and do the plexiglass. Or would you suggest maybe you and your opponent, one of whom has COVID, the other one who has come in contact with COVID, somebody who has COVID, Pence, maybe you should be in different rooms?
Well, I think this does open up some interesting conversation. Clearly, there are a number of principles that need to be followed. First is the more distance, the better. And so, the 6-foot magic distance is probably not enough, particularly in an indoor shared airspace. And so more distance is going to be better. Physical barriers would be appropriate. Making sure that their air handling was at its peak efficiency. They may even need to bring in extra air handlers to scrub the air. But I agree with you. I think that, many of us in our businesses and in our interactions have turned to various virtual forms of communication, and there's really no reason why this couldn't be done in some sort of a format, in a virtual format. It also might help to control the conversation a little bit and actually give the candidate a chance to express themselves more fully.
Well, that's a separate issue, but we could talk about that at another time offline. But I mean, not to put too fine a point on it, but Senator Harris and Vice President Biden have been behaving responsibly, wearing masks, distancing, and President Trump and Vice President Pence and the others have been reckless. We all see it. They don't wear masks. And now we have a hot zone at our own White House. They have these events that are crowded. I mean, I guess just to put it, candidly, why should people who have been responsible about this have to go into a room with people who haven't? One of whom, at least, has the virus.
Well, I think this clearly is a strong cautionary message to all of us that despite very frequent testing with efforts to create a buffer of distance between the president and others, clearly this was not enough. And so wearing a mask anytime when people are in public, when they can't maintain safe distances, particularly if they're in any kind of an indoor airspace, is the appropriate message. The decision of whether folks can come into the debate format safely, as we've already talked about, is going to depend upon a number of variables, and those will have to be carefully considered.
But it does sound as though you think that probably doing it in two different rooms would be the safer, more cautious approach if anybody were asking you, although I don't know that the Commission on Presidential Debates will ever ask you. Dr. Mark Rupp, thank you so much for your time. We really appreciate it, as always. The concern of another coronavirus spike now in New Jersey after President Trump traveled to Bedminster. The governor of that state will join me next.